Today's debate on the programme for government should only be an opening opportunity to address a programme that covers a wide range of issues, that raises many questions and that needs to be fully teased out and explained, with the relevant ministers making themselves available to the Dáil to answer questions on their particular responsibilities within the programme. And this is especially the case in the area of healthcare, and I know that the Minister is unable to be here today. The policy changes proposed in the health section of this programme are very far-reaching. Unfortunately, the programme raises as many questions as it answers on the approach of the new government to healthcare. This programme appears to be a compromise between the insurance-based models put forward by both Fine Gael and the Labour Party. The commitment in the programme is to develop a universal single-tier health service which guarantees access to medical care based on need and not income. And that is a fundamental principle. On that particular point, we have common ground. That's a fundamental principle of Sinn Féin, and one that we have long advocated here in this House. It is our strong view that such a health service, and this is the key difference, can be delivered equitably and efficiently only on the basis of public provision, funded from fair taxation, and with an end to the state subsidisation of the private healthcare industry. The insurance-based model, on the other hand, which is the centrepiece of healthcare in this programme for government, is highly problematic. Experience from other countries, including the Netherlands, on which Fine Gael bases its approach, points to the danger of insurance companies being given an undue role in determining the level of care received by health service users. In the Netherlands today, and it's important to examine what's actually happening there, the insurance-based system has run into huge problems, with 500,000 people uninsured or defaulting on health insurance payments. Private health insurance companies are finding ways to circumvent the ban on risk selection. The universal health insurance basic package in the Netherlands is costing each individual €1,194, and employers have to further deduct a 6.9% contribution from income paid. The average cost of health insurance per household is estimated currently at around €5,000. 41% of people surveyed, Minister, in the Netherlands said that the quality of the health system has worsened since the introduction of universal health insurance in 2006, while only 8% have indicated in that recent survey that it had improved. The government may argue that this programme is a compromise and that it does not fully adopt the Dutch system. But the problems with insurance-based systems have been well identified, and this programme does nothing to allay those concerns. On the contrary, it is quite alarming that the healthcare section of this programme contains no costings, something that we have heard your voices point at Sinn Féin in the past, and apart from only one single instance from the limited initial extension of the free GP care. When Fine Gael initially published its Fair Care plan, it promised to provide further details, including costings, but this has not been done. And I have to ask, and perhaps before the conclusion of this debate, someone on the part of the government might answer, when are we going to see those detailed figures and projections? It certainly cannot be argued that Fine Gael lacked the resources to provide the necessary expertise to elaborate on its policy, given the enormous sums of money that the party has obviously spent in the recent general election. Let it be said that many of the aspirations and proposals in the health section of the programme are commendable. And I want to put that on the record. Sinn Féin have committed to constructive opposition, and where we believe there is something meritorious of praise, we will do so. And I include in that the extension of free GP care to all within this government's term of office. That is a very big commitment. We are told that the extension of free GP care to certain categories of patients in the first 2 years will cost €32 million. But what happens after that, I ask? Presumably the promised extension to all within the lifetime of this government will be dependent on the negotiation of a new GP contract. We are told that all of this will be transitional until the introduction of universal health insurance by 2016. But what happens in the meantime, I ask again? Will the Fianna Fáil Green Party health cuts be reversed? Will the recruitment embargo on the health services be lifted? Will the payment for working student nurses be fully restored?
5 minutes left.
5 minutes has passed.
Passed.
Oh, I beg your pardon. I thought you were going to give me a signal. Well, I will conclude by only saying this last point. I want to also welcome, and I think it's important to press it, the commitment to compensate the women excluded from the Lourdes Hospital Redress Scheme. But I must ask, lastly, what about the issue of Sinn physiotomy? Will there be an inquiry? Gura maith go Cathaoirleach.